Okay.
Good morning. Welcome. Buenos dias.
It says we're still in practice mode, so we need to
Okay.
press start webinar.
Cool. I do. Am I?
Nice.
Good morning. Buenos dias. Welcome to our webinar. We'll be starting in a few minutes. We're just waiting for people to join. Thank you. All right, we're going to go ahead and get started. Thank you so much for joining us today. My name is Patricia Lozano, and I am the Executive Director of Early Edge California. Before we get started, some quick housekeeping reminders. We will be simultaneously translating today's webinar in both English and Spanish. Please select your preferred language using the globe icon at the bottom right side of your Zoom screen, as you see here. Please make sure you select one of those languages, otherwise you will not hear the translation properly. Before I am introducing our amazing guests and partners, I'm gonna tell you a little bit about Early Edge. We are a nonprofit based in California, and we do mainly all about little kids, increasing access to high quality care and supporting dual language learners and, supporting the workforce. As you know, FFNs, or family friend neighbor, are a key part of our system, and that's what we're going to be talking about today. We know somehow you have had that experience because it's your grandmas, abuelitas, tias, neighbors who help us caring our little kids for our little kids. So we are so pleased today to partner with the Center for the Study of Childcare Employment at UC Berkeley. They have been leading research on FFN over the past few years, and we are excited to have them here today to present their findings. We are also honored to have Assemblymember Corey Jackson, who represents part of Riverside County, including Riverside, Perris, Moreno Valley, and San Jacinto, and currently serves as the chair of the Assembly Budget Subcommittee number 2 on Human Services. Assemblymember Jackson has proven to be a great champion for early learning and care, and we're very excited to have him here to provide some opening remarks. Thank you so much, Assemblymember, for joining us today, and I'll turn it over to you.
Well, thank you so much for having me. This issue is very important to me, and I think critically important to the resiliency of our families and our communities. I recognize how just important our foster care and FFNs are important, how important they are to our communities, particularly in the light of the pandemic. And understanding that if we do not have a diverse and robust childcare system, there is no way we can truly claim that California is a state of opportunity, because so many people with brilliance and hard work ethic and good character simply are unable to fulfill their full potential simply because they do not have access to diverse and reliable childcare options. And we can't just rely on the good graces of family members. We need to invest in them too. We need to invest in our grandmas and our aunties and our cousins, right? And I particularly remember myself being a young person and being in elementary school, and my mom still had to work, and so she had to leave us by ourselves because she herself were unable to have the type of childcare that she can afford and available to her as well. So I want to thank you all for the work that you do, and just know that we continue to have big plans for childcare. Not just one type of childcare, but all forms of childcare. Because at some point, and I believe that it'll be inevitable, that something like the pandemic will happen again. And just as we're building our early learning programs on our school campuses, we need just as much of attention to our community-based programs, our FFN-based programs, so that we can make sure that no matter what happens in our society, our children are taken care of. We owe this to the next generation. And it is my goal to making sure that we do our part to actually deliver on the sacred responsibility that we have to future generations. So I want to thank you all for all that you're doing and all that you will do. And I look forward to being out there on the battlefield and in the hearing rooms to making sure that we truly invest in the future. Thank you so much, very much for having me.
Thank you so much, Assemblymember Jackson. We're really, really glad to have you as a champion for us in the legislature. Hi, everyone. My name is Kelly Reynolds, and I'm a senior policy analyst for Early Edge California, and have been doing a lot of our work that's been focused on family, friend, and neighbor care. I quickly wanted to go over today's agenda. So you've already heard from our Executive Director, Patricio Lozano, and you've heard from State Assembly Member Corey Jackson, who is, again, an avid champion for childcare and human services in our state assembly. Today, during our webinar, we'll also be having a presentation by Anna Powell, who is a Senior Research and Policy Associate at the Center for the Study of Childcare Employment at UC Berkeley. I'll also then be providing a presentation on Early Edge's new brief that's focused on how to remove barriers so that family, friend, and neighbor care has better access to the child care subsidy system. We'll then have a panel conversation with some FFN caregivers who have been involved in our Leading from Home program, and a parent who uses FFN care to talk about the strengths of FFN care and what parents and providers really need in terms of support. And then lastly, we'll share some recommendations for consideration based on Berkeley's research and the work that we've been doing with FFNs and those who work with FFNs to talk about increasing access to compensation. If we have time, we will answer some questions. So please, if there's questions that come up throughout this, please put them in the Q&A box, and we'll do our best to get to them at the end, and then we'll close out. But now I'd like to introduce Anna Powell, Senior Research and Policy Associate for the Center of Childcare Employment at the Study of Childcare Employment at the Institute for Labor and Employment at the University of California, Berkeley. Anna and CSCCE have been conducting some great research on FFNs over the past several years that we're really excited to have them share about today. As many of you attending know, the FFN field has been something that is historically sparse when it comes to data. So we were thrilled when Berkeley really took this on to try to find out more about FFN care in our great state. So Anna, I'll now turn it over to you.
Thank you, Kelly. Good morning, everyone. As Kelly said, my name is Anna Powell, and I would love to take over screen sharing. If Kelly, you can give me that. Great, thanks so much. Okay, fantastic. So I come from the Center for the Study of Childcare Employment at UC Berkeley, and I'm excited to share with you some of the data that we collected from parents across California. Now, we conducted 2 parent surveys, one in 2022 and then in 2023. And in that first survey, we started out with over 1,300 parents. And we asked them about all the types of care that they use for their children. And 26% who had a child under age 3 were using FFN care at the time of the survey, along with 29% who had a child aged 3 to 5. And a lot of these parents were using FFN care sometimes in combination with something else, especially for those older children. We also found that the Black parents in our survey were most likely to use FFN care, with, for example, 34% who had a child under 3 among the Black parents. And it's interesting to note that families across income levels are using FFN care. So this is something that is shared across families of all different backgrounds. But we also know that FFN care is often unpaid. And we had in our study 28% who are not providing any type of compensation. Some of the other families were providing cash, but some of them were also just helping their FFN out with their food, their housing, their gas, and other things like that, instead of providing a payment in a wage. Now, let's look for a second at how families are using FFN care at different ages of their children. So if you look at this gold line, that's the line to show you the percentage of families that are using any FFN or nanny care. And you'll see that it starts at the most common form of care for our little babies who are aged in their first year of life and when they're at age 1. And then other forms of care, such as like center-based care, become more and more common as we move up the ages of the children. But FFN care remains in the mix. And if we look within those different types of FFN care, I've taken that gold line and I've carried it over to this chart. I'm now showing you the types of FFN and nanny caregivers that we asked about. And you'll notice, of course, the most common type of FFN provider is a grandparent, usually a grandmother. And what you're seeing here with this blue grandparent line is that almost a third of little babies and infants are being cared for by a grandparent. And this shows just how essential this type of care is, especially for our little ones. And you might be thinking about these other families. Why are they not using FFN care? So we actually asked parents who were making a different choice, whether it was parental care only or using licensed care. And the most common reason parents were not using FFN or nanny care is actually that it was not available to them. For example, maybe grandma lives just too far away. So some people, for example, it says here 25% preferred licensed care, but most commonly it was just not an option for them. So we know that this tells us that preference and appreciation for FFN care is really shared across people. Even if they're not necessarily using it, they may still appreciate that type of care. Now what I'm showing you here are different factors that people have in their decision for choosing care. And I'm breaking out how they're answering in these blue bars. That's showing how FFN families are thinking about these factors. And then the gold are showing how families who use licensed care answer the same questions. And what I want to show you first is this very top line, health and safety practices. Both the FFN families and the licensed care families see this as very important, right? This is a shared value. However, if you look inside the red box, it's interesting to note that these 3 factors, personal connection or relationship, language spoken, and cultural background, the blue bars are showing that it's very important to more families who are using FFN care. So this helps us understand some of the unique strengths that people appreciate when they have access to FFN care and they get to use it. They get to look at these factors and honor those factors with FFN care. We also asked people to fill in the blank for us. We gave them the question, I know a provider or caregiver is right when, and they could answer, I see my child feels comfortable, happy, and safe. I have complete trust and faith in them, and a few other options. And you'll notice that the blue, who are the people who are using FFN care, and the green, the people who are using other types of care, they tend to agree that seeing your child feel comfortable, happy, and safe is the best way to know when care feels right. But the second most common option, if you look inside this red box, we'll see that parents who use FFN, more of them are saying, well, I know it's right when I have complete trust and faith in them. So this adds to this story about the special, unique strengths of FFN care, that you can have complete trust and faith in someone like that. I also want to share with you some quotes from parents who took our survey. Here's a Latina parent from Riverside County who said, only family can handle the care of my autistic son. The local daycare mistreated him when he previously attended. So we know that families who have special needs or disabilities for their children often feel that FFN care is right for them. And then a Black parent from Solano County said, my mother raised 5 children, including me. Her home is on the way to both my husband's job and my job, and I feel absolutely safe with my daughter in her care. So this is echoing that theme of this complete trust. She also goes on to say, my daughter is biracial, and it was really important to me to make sure she is cared for by someone who has a cultural connection to her. So I think these quotes really help to bring those themes that we saw in the data to life, showing how these different factors matter a lot to parents who choose FFN care. One other thing I want to mention before I finish up are the many responsibilities that FFN caregivers can take on, which may go above and beyond what a licensed provider is able to do. And surprise to no one, if you look inside the red box of grandparents compared to other types of FFN, they are most likely to be doing all of these additional responsibilities, such as cooking and serving meals, going beyond perhaps one meal and a snack to be breakfast, lunch, and dinner. They also may be doing transportation, for example, dropping off a school-age child in the morning and picking them up, as well as laundry, bedtime, and enrichment activities. So FFN care not only has that love connection, but they also provide this wraparound care and support, which is so essential to families. So just to give you some takeaways of the data that we just saw, because I know it was a lot of slides. So first, FFN care is used across California, and it is most important for infant care. FFN care is not just a last resort. There are unique strengths that parents see in FFN care. The most common reason families do not use FFN care is that it's unavailable. And grandparents are the most common FFN caregiver, and they also provide the most comprehensive support. And then lastly, families of color especially value FFN care. So I'm hoping that all of this helps to give you some, data and facts that hopefully resonate with your own experience and knowledge about FFN care. Thank you for listening, and I'm happy to share the mic back to Kelly.
Thank you so much, Anna. We're so thankful for all of the research and context that you've been leading. And it really helps, I think, lay a really great groundwork of, why FFN care is so important, what families want, what we see as quality, and also what caregivers are providing and what sort of supports they might need. And so to build upon that research, I'm now going to provide an overview of Early Edge's recent brief that's focused on the barriers that FFNs face in accessing the state's child care subsidy system and some recommendations to support FFNs through that process. So the brief was entitled Increasing Access to FFN Caregiver Wages Through California's State Subsidy System. And so to give a little background on this, in April 2024, we released this brief that was developed in partnership with our FFN work group, which is made up of organizations across the state that provide services to FFNs or work closely with FFNs. So this includes local R&Rs, such as Bananas and the Resource and Referral Network. It also includes public libraries that work really closely with FFNs, such as the San Jose Public Library. And you can see that the brief was co-authored here by Visión y Compromiso, San Jose Public Library, and then Catholic Charities of Santa Clara County. And it was also informed by our FFN advisory group, which is made up of FFNs, again, across the state, that meet on a somewhat quarterly basis to talk about, issues that are pressing for them or challenges in their caregiving or opportunities. And then members of our California Leading from Home program, which is a group of 10 FFNs from throughout California that met monthly to talk about, how to turn their needs as providers into policy and advocacy opportunities. And so that program culminated with a a legislative trip to the Capitol to do some advocacy on uplifting needs that they identified as things that could be better supported by the state in their caregiving. So this brief, again, was released in April, and it documents some of the challenges that caregivers face. The impetus for this brief was when we first started our FFN work group, we wanted to take a look at how can we increase access to supports, such as professional development, play groups that FFNs greatly benefit from, but also how can we increase their compensation. And so as the group talked about compensation, one of the areas we identified that already exists is how FFNs in California can be eligible for the state subsidy system if they are serving income eligible families. And so the reason we looked at this is because generally FFN caregivers are often underpaid, if paid at all. Anna didn't, I don't think, mention this stat in her presentation just now, but other data from some of their reports show that approximately 1 in 4 FFNs in California receive no compensation for their caregiving. And that those that do receive compensation, it's usually well below minimum wage, averaging about $8 an hour. Also in their study, they found that 7 to 13% of FFNs were FFNs were less likely to be able to pay outright for an emergency expense of about $400 compared to the national average. So 7 to 13% of FFNs compared to 26% as a natural average. And so we know that FFNs take very many different shapes. We know that they're predominantly grandparents, but for those that are serving low-income families, they can receive subsidies in California. But despite being the predominant form of care in California and the United States, only 21,000 FFN caregivers participate in the state subsidy system. Despite the low wages that we know FFNs make, and that the subsidy system, as we know across the field, reimburses providers for well below the true cost of care, we see that this is still an opportunity to help get them through to have opportunities for compensation. And so California is also in the process of developing a new alternative methodology for its reimbursement rate system, which would simplify the rate structure and move to a model that would ultimately work to cover the true cost of providing care. FFNs have been included in this conversation and are being included in the cost model process. I'm sorry, Edith, can you go back one slide? So they're being included in that cost model process, which will ultimately, hopefully, increase their reimbursement rates once implemented. We know that once we have this alternative methodology adopted, we're still going to have to do a lot of advocacy around making sure it's fully implemented with funding, and we want to make sure that FFNs are included in that. But again, while the system is imperfect, we see it as an opportunity for FFN caregivers to receive compensation for their caregiving. Next slide. So one of the challenges that comes up first when we're having conversations with FFNs, as well as those that provide services to them, is that many family, friend, and neighbor caregivers are unfamiliar with the term FFN. They've never heard that. They often work maybe in isolated instances serving a family. They don't know that they could potentially be eligible for resources. And in addition to that, many families that are looking for care that could qualify for subsidies don't know that they could receive a voucher, and don't know that if they did receive a voucher, they could give it to the FFN that they may already be working with. So if they have their grandmother taking care of them, they don't know that they might be able to give funding to their grandmother to provide that care. Next slide. Another challenge that we hear about when we're having these conversations with the FFNs within our, our advisory groups and our advocacy groups is that there is a lot of fear and mistrust in engaging in the subsidy process. And that, I think, is attributed to the historical racism that many Black and Latino communities have experienced in interacting with the government. And so there is a legacy of mistrust that has affected their participation in public benefit programs. And so this relates, I think, into three major areas that we saw, which was concerns related to their immigration status, what would becoming a part of a formal subsidy system mean in terms of their information? Would that be, especially given the political landscape of the last 8 years or so, there's still a stigma and a fear about what providing that information to the government could mean, and also how that could impact them in other aspects of their life if they're trying to pursue citizenship, and if they are receiving different benefits, what that could mean for their citizenship status. There's also just a general fear of government oversight and intervention. We talked to some FFNs who were ultimately even interested in pursuing licensure, but were concerned about what that would mean in terms of oversight and having people come into their house and having to do different background checks and having their family included. There was a fear of that oversight. And even though some of those regulations don't relate to the subsidy process, there's a confusion there about what subsidy versus licensure means. And so making sure that that's clearer for people to understand. And then there's also a fear that we heard was pretty common about for FFNs that already receive public benefits, whether that's Medi-Cal or other public benefits. They're concerned about the increase of the subsidy potentially impacting their benefit eligibility. And while we already saw that currently the reimbursement rates for FFN are rather low and would likely not impact their benefit eligibility, there's just a fear that they don't want to sort of rock the boat, so they don't pursue it entirely because of that fear. Next slide. Another challenge that we saw is just issues navigating processes and requirements. And I would say that that came down to cost. While the cost of pursuing the subsidies, is not terribly high, if you're not related to the family that you're providing care to, the FFN needs to complete the trust line background check process, which can be around $130 or $140. And a lot of times that expense has to come up front. They're waiting to get reimbursed. And so sometimes the upfront expenses that come with that can be too much. There's also, the state is coming into compliance with health and safety requirements that are required at the federal level. But from some FFNs, we heard that having just access to typical standard medical care and being able to get things like TB tests were served as a barrier because they're not necessarily participating, like they don't necessarily have access to health insurance and participating in the medical system. And we also heard a lot about just challenges with information sharing and language and technology accessibility. Many of the FFNs we talked to, while they might have access to a computer, it might not be something they're terribly comfortable with. They often rely on their grown or adult children to serve as like their email or supporting their access to the internet and completing different forms. And so because so much of the subsidy process has moved online, which has been really, I think, helpful for many in terms of making it more accessible. For those that are still experiencing the digital divide, that shift to online has been a challenge for them. And so knowing how to access computers, knowing how to navigate, and then also the language barrier if they speak a language other than English. While I think the state of California really wants to be inclusive and make sure that these forms are available in a number of languages, the reality is we're still working on that. And so I think having a combination of supports to navigate online forms and then also supporting through different cultural and language barriers is a really critical piece that can prevent many FFNs from going through the subsidy process, even if they're eligible. Next slide. So just to share some quotes that we heard through this process, one of the San Jose Public Library has a really robust FFN program that provides professional development and ultimately a pipeline into coursework to help to support their caregiving. So the library staff do a lot of one-on-one support with FFN caregivers. So one of the ones that we talked to shared that filling out a W-9 was really scary for some of the FFN caregivers. Many didn't have social security numbers, so they had concerns about disclosing that. Again, you know, you need to have an I-10 to complete many of these forms. Technically, your immigration status should not be a barrier, but the perceived concern about what relaying that information means or going through the process of getting an I-10 can be really burdensome and scary for folks. Some FFN caregivers we work with do not have bank accounts. One provider received a check via mail and had to take an Uber to the bank to cash it in every month. So again, talking about how, you know, we know Ubers are getting more expensive. We know that sometimes the compensation that they're receiving through subsidies aren't very high. And so balancing, like, is it worth it for me when I don't have access to some of these basic mechanisms that I think, you know, we often build systems assuming people have access to. And then from one FFN caregiver, you know, related to fear and immigration status, the question was like, if the government finds out that my adult children have been living in low-income housing or benefiting from subsidies, is this going to, you know, affect my immigration status if I'm going through the citizenship process? So again, just relaying some of the concerns that come up. And I think this confusion about knowing a little bit of information, but not the whole thing, and not having access to sort of that one-on-one support to guide people through the process. Next slide. So recommendations to improve FFN access to subsidies. One thing that we're really uplifting is that we need more coordinated communications and outreach efforts to raise awareness of subsidies for families and FFN caregivers. The subsidy system is reliant, obviously, on the families being served being income eligible. And so it's really in tandem that we want to make sure that families know that they could be eligible, that they could use their voucher for their FFN caregiver if they already have one, and making sure that FFNs know this too, so that more people are going through the process proactively. We need to increase language and technology accessibility to be more inclusive. And I think also, you know, providing one-on-one support to help people navigate those processes that might not have access, you know, that might not be the best when it comes to computers and navigating online systems. We also need to ensure benefits protection. So again, the challenge about individuals being concerned about losing their benefits if they receive subsidies. There are some creative solutions that the state could look at to try to ensure benefits protection. One of which is combining a guaranteed income program to support FFNs. Having a mixture of different funding could allow the state to put some protections around how they're looking at income and make sure that if FFNs are receiving income through a mixture of guaranteed income and subsidies, that they would be able to sort of create language to protect those benefits. And we also would want to integrate support from community navigators to guide FFNs and families in accessing subsidies, pathways to licensure, and other resources. So I think one of the things that come up is just how can we embed more one-on-one support for FFNs? And there are some programs already out there, like the CSCCE program, that provide pathways for FFNs that are interested in licensure. But I think thinking about how we can look to our communities and where FFNs are naturally going, like public libraries, or where they're receiving services naturally with their children and the children they serve. How can we integrate more staff training and supportive resources to create sort of community navigation within those localities, to be able to connect and do like a warm handoff, whether that's to the local resource and referral network or to other benefit programs that FFNs could benefit from. And then lastly, you know, throwing out we want to consider revising subsidy eligibility so that FFN caregivers are directly eligible based on their income rather than going through the family, knowing that they often reflect the same income and demographics of the family they serve. And so removing a barrier by having them be directly eligible based on their income rather than going through the family that they're serving. Next slide. Okay, so we just threw a lot of information at you. So I've been seeing your questions going into the chat. So thank you so much for those that have been throwing in questions. Now I want to transition us to a panel discussion where we have, can you go to the next slide? Where we have, we're going to be hearing parent and caregiver perspectives on the value of FFN care. And we're joined today by Fiorella Herrera, who's a parent that uses FFN care, Nachieli Davalos Martinez, who is an FFN caregiver in our Leading from Home program, and then Eva Alcala, who is also an FFN caregiver in our Leading from Home program. So Fiorella, Nachieli, and Eva, if you want to come off mute and come on video. Thank you all so much for joining us today. Okay, great. And Nachieli, I just want to do a quick mic check. We've been having some audio difficulties. Are we good now?
Así es.
Yay.
Está bien,
Okay,
gracias.
great. Awesome. Okay, great. Amazing. Okay, so thank you all so much for being here and taking the time. I know that you are obviously all have busy lives and are probably actively taking care of children, so we really appreciate your time. Fiorella, I'd love to start with you. Can you tell us the story of how you got started with FFN care?
Sí. Hola a todos, mi nombre es Fiorella Herrada. Yo soy madre líder de Voces de Padres de San Mateo. Mi historia comienza en el 2019 y yo sufrí de depresión postparto severa. Luego llegó la época de COVID. Tuve terapia por teléfono por un año y una amiga me comentó acerca de un proveedor que se llama 4Cs, que ellos ofrecían ayuda del cuidado de niños subsidiada. Cuando se abrieron los vouchers para el cuidado de niños subsidiados por COVID para personas que habían perdido sus trabajos, yo tuve la oportunidad de postular, aplicar y agarré un voucher. Es ahí donde empieza el cuidado de niños, pero debido a mi condición de depresión y ansiedad, yo no quería que algún extraño cuidara a mi hijo. Yo quería que un familiar fuera el que cuidara a mi hijo. Entonces, hablé con mi hermano me dijo que sí, solo teníamos que ver horarios para que no se complicara ni para él ni para mí. Gracias a Dios yo pude conseguir un trabajo de limpieza que lo hago por las noches, en las tardes, noches, y mi hermano cuida a mi hijo a esas horas y yo tengo un horario flexible y eso me ayuda mucho. Lo que yo más amo de FFN es que yo estoy segura de que mi hijo está en un ambiente seguro, está cuidado y no corre peligro de ninguna índole. El pasar tiempo con su tío a mi hijo hace que él no sienta mi ausencia durante esas pocas horas que pasa sin mí. Entonces, para mí eso es lo primordial. Mi hermano, yo sé que es un hombre de familia, también tiene hijos, tiene valores y cría a mi hijo con esos valores. Mi hijo está en un ambiente seguro, un ambiente sano, lleno de valores y eso le da bastante soporte emocional. Esa es mi pequeña experiencia. Espero que les haya servido. Gracias.
Thank you so much for sharing. And I can relate to, your story. My mom was also my caregiver or for my son when he was born. So I understand that connection. How do you see your brother support the growth of your child?
Como yo te dije, mi hermano es un hombre de valores. Mi hermano le enseña a mi hijo, igual que a su hijo, les enseña a hacer cosas en la casa, ellos pintan, ellos hacen actividades como vamos a arreglar la backyard, vamos a hacer cosas de casa, cosas que a los niños les encanta. Ellos pretenden que ellos son los constructors y ellos juegan, pero van aprendiendo que el ayudar en casa es bueno, van desarrollando sus habilidades motoras también. y en un ambiente sano, en un ambiente tranquilo, y todo es en base a la calidad del tiempo que les das y al tipo de, es como que tú juegas con ellos, pero a la vez les vas enseñando cosas que hacer y cosas que tendrían que hacer ellos en una vida adulta. Y esa es la forma como yo siento que mi hermano ayuda a mi hijo.
Thank you. Nachieli, I'm going to turn to you. Why do you choose to provide
Sí,
care for
gracias.
family?
Para apoyar a mi familia, comencé apoyando a mi hija que tuvo mi nieto, mi primer nieta hace 4 años. Comencé con mi nieta, después mi otra hija tuvo mi otra hija tuvo nietos y ahora cuido a mis 3 nietos y al hijo de una amiga. Y lo hago para para apoyar a la familia, a las amistades y para crear un entorno seguro, cálido y profesional hasta donde me es posible. Nosotros, yo no he recibido ningún subsidio, no he calificado, no hemos tenido la oportunidad de calificar para subsidios, lamentablemente, pero nos organizamos de alguna forma. También yo para elevar el cuidado que doy a los niños y la forma en que apoyo a las familias, me involucro en programas físicos y online gratuitos. Busco todo lo que sea gratuito para poder elevar mi nivel profesional de cuidador infantil. Y yo lo que pediría en esta ocasión para el beneficio de los FFNs es el acceso a los subsidios, haciendo que sea más fácil y sencillo el poder obtenerlos, el poder obtener la aprobación y que estos a su vez nos den un ingreso fijo a los FFNs, un ingreso fijo, un ingreso justo y que esto nos dé la calma y el poder hacer nuestra labor con más paz emocional por la cuestión económica para que nuestra labor siga siendo tan honorable como lo estamos haciendo ahora.
Just following up on that, you mentioned that you haven't received subsidies, but what challenges have you faced when you explored subsidies or thought about pursuing subsidies?
Sí, intentamos hacer una aplicación. En el primer programa no aprobaron a mi hija porque mi hija no es un ciudadano americano. En el segundo programa nos hicieron esperar mucho tiempo y no calificó porque sus ingresos sobrepasaron por $5.
Got it. Thank you for sharing. Eva, the research that we just heard from, Berkeley shows that FFNs provide so many different types of support, from transportation to cooking to behavior management. What is one type of support that is important that you provide the children you care for and the families you care for?
Sí, buenos días. Pues yo creo que lo más importante es saber que los niños están en buenas manos. Principalmente nosotros que somos papás sabemos lo importante que es que que haya alguien en quien confiar y que podemos tener esa confianza de ir a trabajar y dejar los niños sin ningún problema. Que no les falte comida y al mismo tiempo ayude con la transición esa persona de un niño, porque cada día ese niño va cambiando, va aprendiendo, va teniendo diferentes emociones. Entonces, una persona que pueda ayudar con esas transiciones para mí es muy importante porque todos esos cambios que cada niño tiene, la disponibilidad de horarios para los papás, sé que es muy importante porque los trabajos a veces no son de horarios estables, son diferentes, cambiantes. Entonces, el saber que estoy aquí para apoyar a los familiares, a las personas a las que necesitan ese cuidado y saber que pueden contar con el no estar preocupado por regresar a las 3 de la tarde a recoger a tus hijos, a las 4 en punto, sino que saber que puedes pedir ese tiempo extra porque tu horario de trabajo cambió, es muy importante. Y brindarlo es muy importante para que ellos puedan sentirse tranquilos y confiados de que hay alguien ahí siempre para tus hijos.
Thank you. A follow-up question for you, Eva, is, we know that FFNs draw on such deep knowledge of caring for children, but we also have heard from you all that you're interested in new information and strategies to support your caregiving. How do you find new ideas about caring for children and helping them?
Bueno, me gustaría que hubiera tanta más información en la que pudiéramos nosotros buscar fácilmente. A veces es muy difícil. Para mí al principio fue y todavía lo sigue siendo difícil encontrar cursos que sean adecuados para mi horario, para no desatender a los niños que tengo a mi cuidado y estarlos atendiendo. Es complicado a veces en internet estarlos buscando, saber por qué camino llegar a ellos. Sí los he encontrado algunos, sé que hay muchos más que debo de encontrar todavía, pero ha costado tiempo, esfuerzo, mucha dedicación a estar encontrando esos cursos. Algunos son costosos, cosas que pues no podemos tomar a veces. Algunos que son gratis, que se acomodan a los tiempos que uno puede, que a veces es en la noche, cuando los niños ya se fueron a casa, 6 a 8 de la noche, que son los que mayormente he tenido la disponibilidad de tomar y que son gratis y que son en Zoom, porque muchos son en otros condados donde uno no puede asistir. Mencionabas el de San José, por ejemplo, que a mí se me hizo muy interesante, pero lamentablemente por no vivir allá, no puedo obtenerlo. Entonces me encantaría que esos recursos vinieran más cerca de nosotros, donde pudiéramos tener ese acceso a nosotros también y no solamente las personas que radican en esa área.
Thank you. And a final question for both you and Nacheli is, what would you like policymakers to know about the sort of resources you would like to have support you in your work as a caregiver? I mean, you've talked about so much about what you've been doing to proactively support your caregiving, but what are the kinds of things that you think the state could do? And Ev, I'll turn it to you first, and then I'll turn it to Nacheli.
Sí, pues como comentaba, tal vez que sean más accesibles a nosotros, en horarios más accesibles también, más fáciles de encontrar, y con una forma fácil y entendible para podernos registrar. A veces es un poco complicado porque una página te lleva a otra, hay un costo por ese paso y después otro costo por otro paso. Entonces, eso nos ocasiona no poder llegar al curso tan fácilmente. Entonces sería bueno poderlos tener y obviamente más recursos al alcance de todas para seguir capacitándonos.
Thank you. And Nacheli, what would you like policymakers to know about the sort of resources you'd like?
Me gustaría que nos apoyaran expandiendo los recursos que hay. Yo cuento con la Biblioteca de San José, con el programa que ellos tienen de FFN, que gracias a ellos me enteré de todas las posibilidades que ellos cuentan, pero sé que les hace falta más, sé que hay más cosas por las que ellos están pidiendo. Y este recurso ha sido invaluable para mí, me ha dado la oportunidad de aprender mucho, pero sí quiero hacer más cosas para prepararme profesionalmente, lo más profesionalmente para poder cuidar a los niños de mejor forma. Y obviamente me gustaría creo que una de las cosas principales es el acceso al ingreso para los FFNs, a los subsidios, fuera más fácil, más abierto, más sencillo, porque de igual manera estamos haciendo la labor y si la hiciéramos con más paz mental en cuestión económica, podríamos estar mucho mejor de lo que estamos, porque lo que nosotros damos a los niños es cuidado, ambiente cálido. En mi caso, a los niños que cuido, que son familiares, les damos también amor, los hacemos crecer con los hago crecer con autoestima, me dedico a su comida, los llevo a la escuela, los recojo, hago muchas cosas por ellos, lo hago con mucho cariño, pero me gustaría que mucha más gente lo pudiera hacer, porque sé que hay personas que no pueden dejar de su trabajo o algunas otras cosas porque su economía no les permite y les gustaría poder cuidar a sus familiares o a sus nietos. Entonces sí me gustaría que fuéramos más apoyados porque sé que hace mucha falta el cuidado de niños, hace falta más FFNs que se pueden dedicar a hacerlo. Eso es lo que a mí me gustaría que nos apoyaran. Gracias.
Thank you all so much for your time and your insight and dedication to serving, kids and families. Your love and passion is felt, through this Zoom screen. And so I thank you so much for your time and being here today. Lastly, before we get to Q&A, I want to just quickly summarize, I think, some of the recommendations for consideration that you've heard from, from our conversation from the Center for the Study of Childcare Employment, and also from our brief is, some takeaways, which is we think it's really important to invest in community programs that FFN caregivers tend to frequent, such as play groups, networking events, and training opportunities at public libraries and parks. You heard it from some of the conversation in our panel that they're really interested in these opportunities. They're interested in networking. They're seeking those out. And so the more that we as communities are providing them and then promoting them, FFNs can really benefit from those and create their own networks. We also think it's important to adopt and train community navigators that can support FFN caregivers, but also families and other providers in being connected to supportive resources, such as these play groups, professional development, subsidies, and just licensing process support for those who are interested. What I think we find is there tends to be a lack of that one-on-one support that could really be fruitful in helping someone navigate through any process. And, there are some FFNs that are interested in licensing. And so the more that there's a little bit more warm handoff and hand-holding through that, they're more likely, I think, to navigate those systems successfully. And then we also want to ensure that new resources flow to all types of caregivers, not just school-based or licensed ones, but also license exempt, knowing that what we really need at the end of the day is more caregivers to be serving all of our, unique needs throughout the state. And a key opportunity to do this is through the subsidy rate reform and making sure that, as we're reforming our reimbursement rate system, that FFNs at least receive minimum wage based on, their regional area. So those are some things that we just wanted to uplift as things to consider as we're talking about this work. And now I will look at the Q&A and see if there's any outstanding questions. I see that some people have been throwing out resources in the chat, which I think are really important to uplift. So someone commented that the California Workforce Registry is a really great resource and available in Spanish, Chinese, and English as well. So that's something that, FFN providers should think about and look to those as also opportunities to support their caregiving. And then is there an official name of the California program that provides benefits? If you're talking about the subsidy system, it's California's reimbursement rate system. Currently, it's a bifurcated system, but essentially FFNs receive, vouchers through that program. So I don't know, Anna, you're also providing a response. If there's something else, please chime in if you want to get off mute and share too, Anna.
Yeah, no problem. I was just going to recommend that you can go to your local resource and referral agency because they can be a conduit to different types of California programs with benefits. Unfortunately, yes, there are several with lots of different names and it's very confusing.
Yes, thank you for, exactly. There's many different types of funding systems. And to Anna's point, it can be really confusing, but that's why we have our resource and referral agencies that they're there to support. And I think one of the points that we're, through this program or through this webinar we're trying to make is that FFNs often just don't know about all of these systems in place. And so how can we be more intentional about connecting those dots and doing outreach to make sure that our FFN caregivers can be connected to those resources that they might receive support from. And did CCPU get uplifted yet for folks receiving subsidies? We have not mentioned CCPU, but I can right now. The Child Care Providers United Union is our union for family, friend, and neighbor and licensed family child care providers. FFNs that receive subsidies can become a part of CCPU and receive the benefits that the union provides. So also really important. And another reason why it's really important for FFNs that are eligible for subsidies to pursue that program, because they could also join the union if they receive subsidies. And then I'm seeing more trainings thrown into the chat, which is awesome. We'll collect these to make sure that we're sharing with our own FFNs. So a question is, how would this study propose minimum wage for FFN providers in comparison to licensed family childcare homes that aren't even paid minimum wage? My response to that is, as mentioned, the state is going through a complete reform of its reimbursement rate process. The goal is that at the end of that process, once fully implemented, providers licensed, center, home-based, are receiving the true cost of providing care, which would be much, much, much greater, as we all know, than what providers are currently receiving. So when we're thinking about everyone receiving more funding, FFNs are harder to establish what the cost of care model is because they're not regulated in the same way that family childcare homes is. So if we're talking about FFNs at a minimum wage, our hope would be family childcare homes are receiving much more based on this new model of the true cost of care. And Anna, I don't know if you want to if there's anything that you would add to that.
Yes, I responded that it's true that we also need wages to increase for licensed providers, and reimbursement rate reform would hopefully provide new and better levels of payment for all different types of early care and education. So we need to come together as an early education field to say that this matters for all types of people that participate in the mixed delivery system.
Exactly. Thank you. And we're just at time. So if I will, we'll take a look through the questions that we didn't get to. If there's any that we want to make sure we share out, we're going to be sending out the briefs as a follow-up for the email, as also a one-page document that we put together that's kind of a highlight of overview of FFN care. And we'll make sure that if any of these questions we didn't get to can be addressed also in our follow-up email. We're so thankful for you all to be here today and for spending this time with us. And we hope this was fruitful and insightful. Thank you all so much for joining.